With your permission, sir, and with your permission, RA, if we are able to begin the session. Yes. Okay. So, good morning, everyone. We're beginning the session. We are fortunate to have two very passionate TB prevention and control leaders with us today. Honorable Minister for Health and Family Welfare, Dr. Harsh Vardhan, the Regional Director for WHO Southeast Asia Region, Dr. Poonam Ketrapal Singh, all have prioritized ending TB in their programs. The regional director with the TB as a flagship area, and of course, Dr. Harsh Vardhan with the TB Mukt Bharat. So it's really a huge honor for us to have you today and to speak to 121 of our TB consultants all over the country. Well, to motivate them because we are hopefully in the last mile of ending TB. We have 45 months to really reach this goal. Thank you for your time and your presence. I also acknowledge Director General Health Services, Dr. Sunil Kumar, the additional DDG for TB, Dr. Sudarshan Mandal, and of course our 121 consultants all online, some of whom have been with this program for 20 years, very passionate about TB. Some are very new. This is their first public health job, and it has more than become a job, it's a vocation for them. Many of whom are in very difficult conditions and hard to reach terrain and districts, but all working to make every district in India TB free. So with this, thank you, sir, thank you, ma'am, for really finding time to address the group. So with that, sir, we can move on with the program. Yes. With that, we will just ask first Dr. Sunil Kumar, DGHS, to address the group. So, DGHS, over to you.
Honorable Union Health Minister Dr. Harsh Vardhan ji, Dr. Poonam Ketrapal Singh, the Regional Director, WHO Sierra, Dr. Rodrigo Offren, WHO Representative of India, the NTEP program officers from the ministry, WHO NTEP consultants who have joined us online. A very good morning to all of you. NTEP is a dynamic and versatile program and always strives to keep abreast with the evidence-based, worldwide better management of tuberculosis. In the recent past, NTEP has grown by leaps and bounds by adopting newer technologies for rapid diagnosis, newer drugs to treat the patients suffering from drug-resistant tuberculosis, and have also, by incorporating into program many new strategies to address the social determinants of tuberculosis. Regular trainings, meetings, and sensitizations are conducted for entire network to keep up with the pace of policy changes being made, which are necessary as per the need of the hour. Regular monitoring and reviews are also conducted, which are so vital and to ensure that the program is going in the right direction. The state NTEP machinery and the WHO NTEP technical support network have played a complementary role and ensured increased access to diagnostics, treatment, and all forms of patient support to every tubercular patient in the country. Unfortunately, while we were on our way to achieve our ambitious goal of ending tuberculosis by 2025, we were hit by the COVID pandemic. COVID-19, with the symptoms which are very similar to that of tuberculosis, caused some setback to our effort. As of date, there is some still 25 reduction in the TB notification in 2020 compared to notification in 2019. However, I am glad to say that timely mitigation measures were taken by the ministry, including enhanced case finding efforts through bidirectional screening and deployment of multi-platform technologies. Several steps to combat the COVID pandemic have indirectly strengthened our health system, which is now better equipped to deal with many other diseases, leading among which should be tuberculosis. Each of these efforts will contribute significantly to battle out TB by 2025. COVID has presented us with these multiple opportunities, and it is now for us to use these to our best advantage. I am confident that with the support of this large network of TSN consultants, the National TB Elimination Program will succeed in achieving its End TB target. With the Honorable HFM launching the TB Mukt Bharat campaign, the clarion call has been sounded once again to gear up towards an end game strategy. Let us resolve to join hands to end TB. TB हारेगा, देश जीतेगा. जय हिंद, जय भारत.
Thank you, Dr. Sunil Kumar, DJHS, and maybe just a few words. We can ask Dr. Sudarshan Mandal, additional DDG, to say a few words.
Honorable Health Minister, Dr. Harsh Vardhan ji, in spite of busy schedule and hectic schedule throughout the country, of his commitment towards TB is not, never less what we are finding now. As far as TB is concerned, TB program is concerned, he is always active and he is always, committed to give suitable time for us in any, these type of meetings, held by the TB divisions or others. So thank you, sir, for your commitment to NTB by 2025. And our Honorable Minister has started TB Mukt Bharat. So we are all together, the Central TB CTD officers, the consultant, the NPOs, all, even the common citizens, all fighting towards this menace. And we are hopeful to NTB by 2025. And we have with us our respected DJHS sir, who has joined virtually today, and along with the persons who have joined physically in the meeting, Dr. Afrin, Mrs. Peden, who is Deputy Head of the Country Office, Dr. Ranjani Ramchandra, and Dr. Parmar also is with us. And from the CRO office, the Southeast Asian Regional Office, I must congratulate Dr. Poonam Khetrapal Singh, who has given time and joined this program and she is with us. And she, along with his team, are joining in this program. And I must mention our CTD officer and all the consultants, whether they are posted in the Central TB Division or working as regional team leads or working at the station, headquarters or in the field level. They are the main, change agents for the country now. Their role cannot be denied. If I go to the history, sir, the TB program, we got independence in 1947, but we started TB program in 1962 as National Tuberculosis Program. So mainly at that time, the diagnosis was based on X-ray, conventional X-ray, and later on sputum microscopy was added to it. But I want to mention that in 1993, there was a remarkable change. As per recommendation of the WHO, we started DOTS here, directly observes treatment supervised. That means seeing the that success of these dots in other countries, we have started as a pilot project in several districts and several states. And at that time, we engaged this medical consultant of WHO to implement these dots. And if we consider some studies, we know that the districts with, where there is presence of these consultant, they completed that implementation of dots within 9 months. And the districts which are not having that support of WHO consultant, they completed the implementation of dots in 18 months. So, I can understand and we can recognize the contribution of these consultants since that 1993. Sir, we have started that RNTCP, you know, the revised tuberculosis, revised National Tuberculosis Control Program in 1997, seeing the success of this DOTS program. Throughout, we started in a pilot phases in some state, then we completed the process of that DOTS throughout the country by 2006. And I am just mentioning the history so that we can understand the role and contribution of these consultant, WHO consultant, WHO NTEP consultant in the program of in the TB program in the country. And in 2007 we started the treatment for drug resistant TB also. And now you know, sir, we have started so many additional components, new components for the TB program. We have started longer oral regimen for the TB patients, so that there is no suffering from the painful injection of kanamycin or amikacin. And we are going to start shorter bedaquiline containing regimen also, whose duration is just like 9 to 11 months, like that of injectable courses. And there are many things we have added in the program. And you know, sir, that we have eradicated smallpox from the country. We have eradicated dracunculitis from the country. We have eradicated poliomyelitis from the country. So it's now time for the tuberculosis disease also. And we are committed to eradicate this disease from the country and elimination of the TB by 2025. For any program, sir, the most important factor is the political and administrative commitment. And we got that commitment from our Prime Minister, Honorable Mr. Modi ji. On 13th March 2018, our PM committed to end TB by 2025, and on 24th March last month, 24th March 2021, our Honorable Minister, Dr. Harsh Vardhan has started TB Mukt for the country. So now that political commitment and that highest level administrative commitment are having with us. So we should not delay for them. I know that these NTEP, WHO consultant, they are committed and dedicated, but we need more dedication, more commitment from the consultant, so that we can reach to a level, to elimination level by 2025. I know that they will be more proactive, and we are going to start a strong mechanism to supervise, to monitor and supervise this network. This is called technical support network. So that the main purpose is that we can identify the weaknesses at various levels of this network and can take corrective action immediately at that level. And if there is gap in the network, we can bridge up the gap immediately at that level. And also the consultant can raise some concern to us to the country office, to us, Central TV Division, Ministry of Health, so that we can, satisfy their concern, we can take proper action for their concern, so that the network, that TSN technical support network, and along with CTD, can go hand in hand and to see a new India without TB. So thank you very much, sir. Hand over to Dr. Ofrid.
Thank you, Dr. Mandal. It's now my honor to introduce the Regional Director for WHO Southeast Asia Region, Dr. Poonam Ketrapal Singh, for her address. Ma'am, the floor is yours.
Thank you very much, Rod. And Honorable Minister of Health and Family Welfare, Dr. Harsh Vardhan, Director General Health Services, Dr. Sunil Kumar, and other staff from the Ministry of Health, and importantly, the TB Technical Support Network. A very good morning to you all, and my thanks to the Honorable Minister of Health, Dr. Harsh Vardhan, to whom goes the credit of organizing this meeting. It is a privilege to address you today, and let me begin by underlining the critical importance of your work. Since 1999, this network has facilitated the full-scale implementation of WHO recommended strategies, accelerated the achievement of country-wide TB service coverage, fortified TB surveillance through the Nikshay initiative, and promoted the establishment of TB-free district and state projects under India's ambitious national strategic plan. To this can be added the Honorable Health Minister's initiative, making it a people's movement through the TB Mukt Bharat campaign. You are the tip of the spear in the quest to end TB in India, the Southeast Asia region, and the world. And today, that quest, which is one of the region's 8 flagship priorities, is at a critical juncture. Before the onset of COVID-19 pandemic, India was making rapid and sustained progress on TB, accelerated by the 2018 Delhi End TB Summit, which was inaugurated by the Honorable Prime Minister of India, Shri Narendra Modi himself. India has adopted the extraordinary goal of ending TB by 2025, 5 years ahead of the global target. In 2019, some 2.4 million TB case notifications were recorded, which was up 12% from the previous year. Between 2016 and 18, India's domestic TB budget more than quadrupled, from $105 million to $458 million. At the beginning of 2020, India aimed to achieve 2.9 million TB case notifications, reaching almost 15% of that target in the first 2 months alone, a 6% increase on the corresponding months of the previous year. But the emergence and spread of COVID-19 had a significant impact on essential health services, including for TB, as it did in TB-affected countries across the world. In April, case notification dipped to 60%, an alarming figure that, if sustained, would have set us back many years. However, thanks to the rapid action of the Health Minister, India was able to quickly revive and maintain TB services, recording a total of 1.8 million TB case notifications for the year, equating to around 75% of the previous year's tally. I take this opportunity to commend the tremendous work of TB program staff, supported by the technical support staff, to continue to find, test, and treat TB throughout the pandemic. while also responding to the pandemic itself. Throughout the response, NTB staff and network members have provided high-end technical support in planning, logistic forecasting, surveillance, and contact tracing, and have also carried out trainings and added, in addition, vaccination preparation. As India's unprecedented vaccination campaign proceeds, I urge network members to continue to help strengthen the basic public health measures that have allowed the spread and saved lives in all corners of this country from the beginning of the pandemic. But we must also now catch up and reclaim the advantage against TB, for which I joined the Health Minister's call for a Jan Andolan and reiterate WHO's commitment to achieving a TB Mukt Bharat. Today, I have 3 messages for the many members of the network gathered here. First, keep your eye on the goal and be relentless in your efforts to achieve it. Through the Gatiman initiative, your mission is to disseminate knowledge and to support NTP counterparts in their efforts to adopt and integrate it into policy planning and implementation. I'm certain you will rise to the challenge and achieve more than anyone can imagine. Second, identify areas where you can leverage and apply your value. For example, in the rollout of WHO recommended diagnostics and treatments that are shorter and more patient-friendly. Such diagnostics and treatments are critical to countrywide efforts to increase access to and uptake of preventive TB treatment, a key priority in moving forward. They will also promote higher treatment acceptance rates among people with drug-resistant TB, while also reducing logistic challenges. Third, be innovative. The second of the Gatiman initiative's core components requires you to inform key technical activities as well as high-level advocacy and public-private partnerships. In your efforts to strengthen IT support, help build new knowledge management platforms, support implementation research, and advocate for TB infection prevention initiatives. I urge you to think laterally and find new ways to accelerate progress that is people-centered and which engages and empowers affected communities. The establishment of multi-sectoral collaborative networks at the subnational level would be particularly valuable, especially if led by and supported at the highest possible levels of state government. I extend my very best wishes to this network, which, like the polio network before it, should be considered a global best practice that can help countries accelerate progress towards ending TB death, transmission, and catastrophic costs. Let's join the Health Minister's call for making 2021 the year for TB through a people's movement, TB Mukt Bharat, to achieve India's target of ending TB by 2025. I thank His Excellency Dr. Harsh Vardhan for this opportunity and look forward to our onward journey towards a TB-free India, a TB-free Southeast Asia region, and a TB-free world. Thank you.
Thank you very much, RD. Thank you for your address, very inspirational to all of us. And now I have the honor to introduce Honorable Minister of Health and Family Welfare, Dr. Harsh Vardhan for...
Good morning, friends and colleagues. I would like to begin by extending my greetings to the Regional Director of WHO Southeast Asia region, Dr. Poonam Khetapal Singh, and WHO representative to India, Dr. Ofrin. And of course, with me today, I am really privileged to have the dignified presence of the DG of Government of India, Professor Sunil Kumar, Madam Payden, Deputy WHO Representative of India, Dr. Sudarshan Mandal, our Additional Deputy Director General TB, whom we heard just now, Dr. Ranjini Ramachandran, the National Professional Officer of TB and Labs, WHO India, Dr. Malik Parmar, National Professional Officer, Drug Resistant and Latent TB, WHO India, Dr. Kiran Rade, the National Professional Officer, TB Epidemiologist, WHO India, and all the other WHO National Professional Officers for TB and consultants from across the country who have joined us online today. Friends, I am really grateful to all of you for your long awaited presence in this meeting. I have been literally starving to meet all of you, and I have known your contribution on number of occasions in number of issues for many years now. So I was desperately wanting to at least during COVID times have one meeting with you, at least virtually, till the time we get the opportunity to be with you physically also, and I'm sure that we'll get that opportunity also in the near future. So dear friends and colleagues, it's indeed an honor for me today that I ultimately have got this opportunity to be able to address your fantastic network of public health professionals whom I have known for years, and I know that who have continuously been bringing their rich experience and strong technical skills into our national tuberculosis program. Before I venture to discuss many other things, I know already our Regional Director WHO, Dr. Poonam Khetapal Singh, has highlighted and underlined most of the important things, and she has reiterated and she has appealed, and I think she has given good quality guidance to all of us. But I think it is important for me to congratulate each one of you for your remarkable contribution and tireless efforts to try and end this public health menace of tuberculosis. Your support to Indian Council of Medical Research and the Indian Association of Preventive and Social Medicine for the recently conducted sub-national disease certification is also highly commendable. I feel delighted to say that with all our collective efforts, we have now declared one union territory, that's Lakshadweep, and one district in Jammu and Kashmir, Badgaon, as tuberculosis free. I think this is a landmark achievement to begin with, and I think it has already set the tone for a TB free India by 2025. As you all know, the last few years have seen our country make significant strides in improving health indicators. These advances have been unprecedented in terms of both their scale as well as their reach, and they bear a rich testimony to our combined commitment towards a healthy and more productive India. World Health Organization, where I have also enjoyed the privilege of being associated with it as an advisor also for a number of years, and have worked like you also for many years in the field, has always been a constant source of transformative change in all health matters, right from technical support, research, policy, monitoring and evaluation, capacity building, to public health communication and knowledge dissemination. The World Health Organization has always been there to support us, be it in drawing up the national health policy or in initiatives like Ayushman Bharat, strengthened primary care through health and wellness centers, or the promotion of digital health, to name a few. I remember our struggle against polio and how, against all odds, we managed to wipe out polio from the face of our country. As someone who had enjoyed the privilege of being blessed by God to dream and work for a polio-free India consistently, I can never forget the contribution of the World Health Organization and its consultants and its senior officials consistently from the day one when I had the privilege to dream about a polio-free India on 20th December 1993. And I distinctly remember that on the very next day, the first place where I wrote a letter was to the WHO's Southeast Asia region office, asking for all relevant documents related to polio eradication from all parts of the world. And all those informations and documents and publications that were delivered to me, they actually became the game changer for me in my life. They gave me the way to work in the health sector and work to accomplish a dream. So, given India's vast population, it was really a Herculean challenge. After all, at that time, India constituted over 60% of all the global polio cases till as recently as 2009. But eradicating polio was a feat of dedication, commitment, and simply going all out on immunization activities. Thanks to the singular commitment of our government and, of course, WHO. The Indian experiment and the resultant success story in polio changed the global game. And now it serves us as an example that eradication of polio is indeed possible if there is a strong political will coupled with committed resources. I have always said on number of occasions that when India decides, she achieves. Despite not being counted in the global superpowers, India has exhibited to the world its commitment to achieve the impossible. We have once again exhibited our prowess to the world, shown the world how we fought the dreaded COVID-19 pandemic. The year 2020 will be etched in public memory as one where the world found itself in the throes of an unprecedented public health crisis. The outbreak of COVID-19 exerted unimaginable pressure on our healthcare systems. However, I am proud to state that, led by a visionary leader like our Prime Minister Shri Narendra Modi ji, we put forth a strong response, rapidly undertaking contact tracing and active case finding to identify, isolate, and provide timely care to patients. WHO consultants were pulled in from across different programs to combat and contain COVID 19. And I thank each one of you for your diligence in ensuring the continuity of healthcare services during COVID times and helping to stop the pandemic in its track. I assert that a similar unified action plan and urgency is now required in our ongoing battle with tuberculosis. I have been informed that the consultant network has played a significant role in the achievements that have been clocked under the National Tuberculosis Elimination Program, and therefore we have also been able to reduce the number of missing cases and achieve successful treatment outcomes. This is an encouraging sign, and it reflects that we are now able to provide better access for tuberculosis patients through our health sector, both public as well as private, and also reach out to communities through our active case finding drives and provision of free treatment to tuberculosis patients. As proper diagnosis and prompt treatment are key to tuberculosis elimination, the consultant network must now focus equally on both the aspects. Number one, early detection of cases, and number two, prevention of new cases. My dear friends, tuberculosis cannot be eliminated without the active participation from each one of you. On the World TB Day recently, I had officially called out for a TB Mukt Bharat and had requested all of you to rise to the occasion and pledge to make our country tuberculosis free in the next 4 years. To fulfill our dream of a TB Mukt Bharat, we need to make this into a genuine people's movement. We will have to do more over and above what we are currently doing, and to bring together those who are working in silos. The success of this campaign solely depends on the activities reaching our grassroots population. We must create scalable and replicable models at the earliest. Action has to pivot around states and, most importantly, in and around hard to reach areas. No two states are the same, and we need to customize activities as per the geography to accomplish a multiplier effect and bring in perceptible and measurable change. It is high time that we join hands to build upon the work already accomplished, in which an international and prestigious organization like the World Health Organization has been supporting us for the last 70 years or so. We must expand collaboration beyond medical interventions to include other ministries of the Government of India, percolate to the level of Gram Panchayats, and most importantly, we must reach out to our elected representatives. It will be crucial for each one of you to play the coordinator's role at all levels, to synergize the interventions and efforts of all implementing partners. At this point, I want to reiterate that we are not dependent on any donor for sustaining this WHO TSN network. This network is purely funded by our domestic budget. Therefore, only your performance is crucial for achieving our goals. Dear friends, eliminating tuberculosis from India is not only important for this country, but also has much deeper ramifications for the whole world. I am confident that since India has resolved to end tuberculosis, it will most certainly accomplish this stupendous task. I am optimistic that with the support from the WHO NTEP consultant network, we will be able to realize our collective determination of eliminating tuberculosis from not only India, but from the face of the earth. But I must add, the deadline for action is today. We must act, and act forcefully, and act now. Fortunately, we are blessed to have the strong political will that this requires, and strategies that are owned and supported by the international community. However, in a target that we have set out to accomplish together, I must speak only the truth. Eliminating tuberculosis by 2025 is not a mean task. It will require collective responsibility of each and every citizen of the country, which is why I have given it the name of a Jan Andolan, a citizens' movement. We need to collectively build this Jan Andolan and give tuberculosis elimination a push like never before. Otherwise, we cannot expect dramatic improvements in the status. Nor can we expect to raise access to quality services for poor people, hard to reach patients, HIV positive tuberculosis patients, and those ill with drug resistant disease. We also need good communication, policies, as well as training. All that we do must be aligned perfectly to a common cause, shared explicitly by all leaders and citizens to stop tuberculosis. All of you present here today are part of this big partnership with the Government of India. We are all together in this, but this partnership must be rooted in the strength of our conviction and the will to act. I call upon all of you today to become the agents of change, to act, and to act forcefully, and act now. We cannot afford to be complacent. I want all of you to promise to me today and now only that you will henceforth move with a collective, unhindered, and clear vision to rid the country of this dreaded disease. Let us promise to ourselves that by 2025 we shall fulfill the target set forth by our beloved Prime Minister of eliminating tuberculosis from the face of India. Friends, the future is always in our hands. The choice is always ours. I am sure you will not disappoint me. With these words, I thank all of you once again for giving me this splendid opportunity to share my thoughts with you. May God bless all of you. Wish you all good health and success in all your endeavors in the future. Thank you.
Thank you very much. Maybe just before we close, we will ask one of our TB consultants to speak on behalf of all the 120. I'm very sorry we cannot have all 120 of you speak. But I would like to call on one of our TB consultants, Dr. Shibu Balakrishnan from Kerala, to just speak on behalf of the TB consultant network.
Thank you, sir. Good morning, Honorable Minister for Health and Family Welfare, Shri Harsh Vardhan ji. Good morning, Regional Director, Srimati Poonam Kettabal Singh ji, and WHO Representative India, Dr. Rodrigo of him, and all those who are here present today, including the Director General of Health Services and all the team members of WHO TSN. Honorable Minister, thank you for encouraging us. Thank you for motivating us. Thank you for acknowledging our hard work. Sir, you asked us to pledge our commitment today to NTB from India. Sir, we are committed to ending India. We really are proud of being the forefront fighters of the army against TB, led by you, sir. 20 years before, when I joined as a consultant to this network, like many of the others who are present today in this network, sir, we were ridiculed in the other countries when we visited for coming from a country with the highest TB burden, sharing 25% of TB burden of the world. And domestically, when we travel to the private sectors to engage the senior pulmonologists, physicians, they ridicule. Here you are speaking about controlling TB, which is a never happening strategy, never tried to eliminate tuberculosis or end tuberculosis, because this is a disease with us forever. But we, sir, we remind ourselves, remained very committed from that point onwards to save our brethren from the sufferings of TB. Sir, I have seen as a young professional in the private sector working for some time during my early career that people are dying with TB, including my relatives. And when I specialized in anesthesiology, I, after some time, quitted that to be a public health practitioner just to fight TB. And I still continue to fight TB as a regional team leader in the South India, mentoring the newly joining consultants and some of the experienced consultants. Sir, we have been instrumental in strategizing for TB policies in the state level and the district level, and to implement all those key strategies of Government of India in the states and the districts. Yes, we were agents of Government of India to end TB. We call ourselves, like people call as the federal agents in US, or most of the agents in Israel. We call ourselves as the TB terminators of India. Sir, under your leadership, we are happy to fight TB, and we will swear today, reiterate our pledge that we will end TB in India. Jai Hind. Thank you very much.
Thank you very much, Dr. Shibu. Now it's time for us to end the call and the interaction. First of all, I would like to thank Honorable Minister of Health and Family Welfare, Dr. Harsh Vardhan. Thank you. WHO Regional Director, Dr. Poonam Kettrapal Singh, Regional Director for Southeast Asia Region. Thank you very much, ma'am, for your time. Of course, DGHS, Dr. Sunil Kumar, Dr. Sudarshan Mandal, additional DG for TB. Thank you. The WHO team who is here, thank you very much. And of course, the TB Consultant Network. Just to try to summarize what the guidance is from both the regional director and the health minister, maybe it is to look at really that we can draw from our experiences of eradication, whether it was polio, COVID, we were able to jointly bring this down. We'll bring it down again as cases are rising. And of course, TB. In spite of all the challenges, TB will be on track in terms of its elimination through detection, active case finding, prevention, education. It's basically doing more, probably of the same, but doing it smarter. As the regional director has told us, let's add value in our context, let's innovate. That's the only way it can move faster in terms of elimination and ending TB in India. We have been called upon to act now, act with speed, act with gatiman, and act with unwavering commitment that we have just heard from one of our consultants. The implications are huge for a TB-free district. It becomes a TB-free India, TB Mukt Bharat, a TB-free region, as the regional director has told us, and a TB-free world. So I guess this is just really one of the starts of many more interactions. Thank you very much to all once again for all your commitment to TB Mukt Bharat. Thank you, everybody. Thank you, sir. Thank you, ma'am.